Member for Central
Actually
Reedbelt.
answer the question.
Mr Speaker, my question is to the Minister for Regional Development. Minister, can you please provide an update on how the Liberal National Government's Royalties for Regions program is supporting regional health services?
Leader of the National
Thank the
Party.
member for Central Reedbelt for the question and for her excellent leadership with the Minister for Health in delivering the Southern Inland Health Initiative, a major change to the way we deliver health and certainly improving health services. The opposition in recent weeks has been making a lot of commentary about the Liberal National Government's management of the state, and I think it's important to put on the record exactly what has happened over the last 5 years in terms of health, particularly in regional Western Australia, but no one can drive around metropolitan Perth without seeing the massive investment in health infrastructure and health service delivery undertaken by the Minister for Health and the Liberal National Government. But in regional Western Australia, it's just the same. If I can go back to 2008, Albany Regional Hospital, promised election after election after election by the member for Albany when he was in government, never even close to being able to deliver that. And I'm very, very sure that if the Labor Party had have taken the Treasury benches in 2008, that project in Albany still wouldn't have happened. The same in Kalgoorlie and Esperance. Again, plenty of promises, plenty of talk, no action on actually pouring some concrete and getting underway with delivering the upgrades that are vitally necessary for those communities. Well, Geraldton is one that you did and built it too small, and now it's too small already 3 or 4 years after doing it, which is another classic case of your ineptitude at managing regional health, which is why your ineptitude at managing regional health. Since the Liberal National Government came to power, already in May 2013, a $161 million Albany Hospital was opened. $161 million new addition. As well as that, additional mental health beds, improved maternity, improved day surgery, and a high dependency unit at the expanded emergency department. The Kalgoorlie Health Campus is well down the track of their major expansion. In November 2012, in the emergency department and high dependency unit and medical imaging department opened, and it was one of my favourite moments in politics. The local traditional owner doing the welcome to country, when he stood in front of the assembled community, said, "This feels like I'm in Perth." He said he felt like he was in Perth walking into the Kalgoorlie Hospital, exactly what the intention of the Liberal National Government was, to try and replicate the type of service delivery we can deliver in the metropolitan area in those major and regional centres. We're doing that now in Kalgoorlie. We're doing that now in Albany. The $500 million Southern Inland Health Initiative is upgrading regional hospitals in Collie, Katanning, Narrogin, Manjimup, Merredin and Northam, as well as implementing primary health initiatives such as diabetes educators and mental health programs. We have focused on GPs. Everyone can remember the massive shortage of GPs we had across regional Western Australia. Couldn't get an appointment with your local doctor. Under the Southern Inland Health Initiative, 27 new GPs operating in regional Western Australia, reducing the waiting times to go to a GP and making sure people can access that primary health. We've addressed aged care and community needs in the Albany Community Hospice and Eon Thriving Communities. We put funds into the Royal Flying Doctor. Who can never forget Jim McGinty calling a flying doctor an interest group, saying that the flying... And the interesting thing about that, because the Honourable Jim McGinty is retired, so we don't need to talk about him, but where was the condemnation from members opposite who sat in the chamber while their Minister for Health called the flying doctor an interest group? No condemnation. No condemnation, simply said, bad luck flying doctor, you're just an interest group. It was the Liberal National Government that put millions and millions of dollars, 5 new aeroplanes, now an aeromedical jet, as well as funding the doctors and the nurses to keep the flying doctor, reducing their response times in regional Western Australia. And announced in this year's budget $160 million Northwest Health Initiative, focusing on Newman, Roban, Onslow, Tom Price, making sure those towns in the inland Pilbara region are upgraded in terms of their health. And I think it's really important to understand exactly what we found when we came to government, because Christine O'Farrell was the boss of Country Health, a very important health bureaucrat in Western Australia. And when Christine O'Farrell retired, in the West Australian on the 26th of March, I don't have the date, I'll put this in the Hansard later, in the West Australian, Christine O'Farrell claimed that some parts of rural Western Australia had been left with blatantly bloody unsafe healthcare. That was the boss of Country Health saying that the health system in regional Western Australia was blatantly bloody unsafe. And that's why the Minister for Health, the Liberal National Government, got on with the important parts of rebuilding regional health, rebuilding the service delivery with doctors, telehealth, new innovation in our health delivery, because we understood that blatantly bloody unsafe healthcare in regional Western Australia was unacceptable. And to give you an idea of the Labor Party's response to the blatantly bloody unsafe comment, the Honourable Jim McGuinty said that was a rather intemperate outburst. A rather intemperate outburst. They treated country people needing to access health with absolute disdain, and that is why the Liberal National Government has made an unprecedented investment in regional health, and that's what's made the big difference to regional development.